I have a daughter Lauren, and when she was 3 she was diagnosed with Ewing sarcoma, which is bone cancer. I was 9 months pregnant with my second baby at the time, and so I had that baby, and really the three of us and my husband sort of alternated between hospital and hospital for 12 months.
Our daughter Holly was 2 weeks shy of her 7th birthday, and she just had an ongoing cold and an ongoing sore on her lip that didn't heal. Decided to take her to the doctor. He was really concerned, and he said, you need to go and get a blood test straight away. Within an hour, the GP rang me. He said, you need to go straight to emergency. I think they gave her a blood transfusion that night, and she was on the operating table the next morning first thing. And chemotherapy started then. And it was 2 years of chemotherapy and treatment.
My daughter Imogen, who's now 11, at the age of 6, was diagnosed with medulloblastoma, a very serious brain cancer. When Imi relapsed the first time, sitting her on my lap, looking her in the eye and saying, "My little chicken, I'm sorry, Daddy can't protect you. Daddy can't make this go away."
So going through cancer treatment is often a very, very difficult time, both for the children and also for the families. Because the treatment is so rigorous, they need to spend a lot of their time in the hospital. Oftentimes one parent will need to stop working. Children often don't get to go to school regularly or at all during their treatment. So it really disrupts the entire family's life. Organisations like Childhood Cancer are crucial there in that they provide enormous amounts of support for not just the patient, but importantly the parents and also brothers and sisters during this really difficult time. So we find their input to be extremely valuable in that regard.
So the Childhood Cancer Association exists to provide a range of support services to children with cancer and their families, and we've been doing that for the last 35 years.
We didn't have any family around us at the time, so they were wonderful for organising things. They told us what to do, where to park, and they'd drop in a cappuccino in the morning, and it was someone to talk to, and they were wonderful. So we became really close with them.
The Childhood Cancer Association also provides tutoring support, and that was one stress that we just didn't have to worry about, so we're really thankful for that.
Yeah. Elliot has had sort of an amazing journey because he first started life as a gift to all children that were diagnosed with cancer. And, he was really popular because he's soft and, he's a lovely little cute toy. But he's evolved, like the rest of the association, to take on a much bigger role. Now he's our mascot, he's an item of merchandise, so he's a fundraiser, but probably most importantly, he's become a therapeutic tool.
The first time she relapsed and went in for brain surgery to remove the relapsed tumour, the guys from CCA brought her in, and Elliot with a bandage around its head, which Imi had on her head. And she just connected with that. She just loved that. So the week she was in hospital, she just held on to that Elliot with a bandage around his head the whole time, and it now kind of lies next to her on her bed at night.
Kids write to Elliot, and they write the most amazing letters. Elliot will write back to them, and he will talk to them about their fears, or if they might be angry, all sorts of things. But yeah, Elliot responds and helps them with whatever their concerns might be, and that's the children obviously that have cancer, but it's also the kids, their brothers and sisters.
My story started when I was 6 years old. I basically found out that I had acute lymphocytic leukemia. As soon as I turned 18, I applied to be a volunteer here at Childhood Cancer Association because I just wanted to be a part of it. I just wanted to make sure that these charities stay in my life for the rest of my life, and so that I remember how much they gave to me, and it also helps me to give as much to these kids now. So because I've been through all that, and I know how much attention, how much love, support that these kids need, and their families as well.
So the big challenge for us is that we don't receive any ongoing government funding. We need to raise over $1 million every year so that we can keep delivering the 30 services to the more than 400 families. So fundraising is always a big challenge for us. So if you're looking for a charity partner, if you just want to get involved with a charity, we would love to hear from you. You can volunteer. There's a lot of different ways that you can get involved. So yes, please give us a call or come and see us.
Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.